pharmacists are always very careful when it comes to dispensing drugs without prescription.
Yeah, thank you very much. Welcome to the 2020 World Pharmacists Day, put together by the Public Health Committee of the Pharmaceutical Society of Nigeria, Lagos State branch. By the special grace of God, yours truly will be hosting this event. I'm not doing it alone. My name is Adepoju Kehinde Phillips, and I'll be doing this with Pharmacist Adeola. Well, together we'll be steering the ship for this webinar. Without wasting your time, you will agree with me that this webinar is a very special one. Special because of what the year has been like, and of course, because of the role of pharmacists in the community. We have not only successfully practiced as professionals, but we've played a very cardinal role in flattening the curve of COVID-19. So wherever you are watching, I think you should give a thumbs up to yourself for playing such a huge role.
Oh, okay. Hello, good afternoon. My name is Adeola Owodunni. It is lovely to have you all join us this afternoon. And it is a great honor to have Dr. Tometi with us. Dr. Adekunle Tometi, RPH, FAMD, MPSN, FNACSA. Dr. Adekunle Tometi is an entrepreneur that strongly supports pharmacist empowerment, as well as public health advocate. He's a high-energy manager, successful in building and motivating dynamic teams, cultivates a work culture where team members feel comfortable voicing questions and concerns, as well as contributing new ideas that promote people and organizational growth. He has 20 years multi-unit managerial experience with a deep understanding and practice of strategic planning and people management. Dr. Tometi is President, Remington Pharmacy Incorporation and Total Pharmacy, Texas. He has been a district manager at Heckard Drugs and CVS Pharmacy. Dr. Tometi is a pharmacy alumnus of the University of Ife and back is PharmD from Howard University. He is a member of Texas Pharmacy Association and serves on several committees, including the Public Policy Council. He is also a member of PSN Council, where he represents pharmacists in the diaspora. Dr. Tometi is an astute public speaker, an accomplished pharmacist, an investor, business leader, strategist, and coach. Let's welcome Dr. Adekunle Tometi.
Thank you very much for that warm introduction. I'd like to congratulate the Lagos State PSN and my brother, Pharmacist Bolagade Iziola, on this day that we celebrate World Pharmacists Day. I also want to observe all protocols respect all my seniors in the house, to the gentleman who said he cannot unbuckle my shoes. I don't even wear no shoes at all, so there's nothing for you to unbuckle. And to all my colleagues that are listening both here in America and back home, I welcome you to this event. I'm going to try to share my screen. Yes, let me see. Let's go here. Okay. Today, I've been tasked with the responsibility of discussing the pharmacist's role in advancing global health on World Pharmacists Day, which really is tomorrow, but we are doing that here today. The agenda this morning will be for us to try and understand what is global health. We'll try to define it. We would also look at who the partners are in the global health team and what is their interrelationship as well as interdependency. What does that look like? We would look at the current approach and opportunities that exist in the way we deliver global health at the moment. We will look at the effect of poor quality health services delivery. And we'll also look at the pharmacist's role in advancing global health. At the end of this, we will talk about the importance of pharmacists in public health. Let's try to define global health. Global health is the health of populations in the global context. It is actually a science. It is the area of study, of research and practice that places a priority on improving health and achieving equity in health for all people worldwide. Problems that transcend national borders or have a global political and economic impact are often emphasized in global health. Thus, global health is about worldwide health improvement, reduction of disparities, and protection against global threats that disregard national borders. Global health can be measured as a function of various global diseases and their prevalence in the world and threat to decrease life expectancy in the present day. From here, we can pick out a few very important things that when we talk about global health, we talk about health conditions that transcend borders. And more importantly, we talk about health conditions or disease state that pose a threat to decreasing life expectancy in the present day. Many developing countries are currently dealing with the burden of both communicable and non-communicable diseases, especially the countries that are in Africa or in Far East Asia. Thus, global health is deemed as important to promote equity in healthcare access across region. What we're saying here is we cannot try to control a global health situation in one region and fail to control it in another. And this is the reason why there's always a pandemic, because we are not attacking it as a global crisis. So global health really should refer to the scope of the problem rather than a geographical location. Because what may happen, as we all are aware, happened in Sierra Leone and Liberia with Ebola. Before we knew it, it was almost overtaking the whole world. So we cannot talk about global health by just limiting the problem to a geographical location. Rather, we will talk about global health, extrapolating it to how it impact the health of the people globally. Now, there are many disciplines that are involved in global health. It's not just doctors, it's not just pharmacists, government is involved, epidemiologists are involved, sociologists are involved. Other things like environmental factors. If you tune into the news nowadays, you see what's going on in California. There's a lot of wildfire going on over there. Climate change issues. There's also cultural issues. For instance, I'm sure we're all aware that there's a lot of work going on COVID-19 vaccines. And we know at the moment that there will be a lot of vaccine hesitancy based on people's culture or people's perception of the disease at the moment. Now, the partners take into account both medical and non-medical disciplines, such as the ones I've mentioned before, epidemiology, sociology, economic disparities, public policy, environmental factors, cultural studies, etc. Each of these practices are inextricably connected. By learning from each other and pooling resources, great progress can be made for the benefit of human and animal kind. I'd like us to take a look at 6 or 7 prominent global health issues that we need to be aware of. The first one will be pandemics. Simply put, what are pandemics? Pandemics are global disease outbreaks. Somehow it looks like every year we are seeing an outbreak of a pandemic. There was a time it was the swine flu. There was a time it was Ebola. And we all looked forward to 2020. All of a sudden, we now have the COVID-19 virus. Examples of these pandemics also include HIV. That's been over 20 years right now. We have H influenza, which is the common flu. We have SARS. We've had Ebola, and we have other viral threats that reflect our vulnerability to widespread diseases, many of which originate in animals. Every year, there are newly emerging pandemic threats that cannot be solved, and diagnosing symptoms may only occur after an individual is already infected. Now, the second thing we look at is environmental factors. There's growing concern about environmental center on climate change and air pollution. With air pollution and climate change, the biggest worry lies in water resources or water sources and sanitation. Now, we know that when the water sources are polluted, or when basic survival needs are disrupted by devastating storms, flooding, drought, air pollution, diseases are more easily spread across large groups of people. So in California, for instance, we continue to worry that hopefully there are no fast track to a second phase of COVID because of the fires they're having. We also know that when there's famine or when there's drought in East Africa, it poses a very, very large risk for spread of diseases. The third thing I want us to be aware of is economic disparity and access to health care. Communities across the world still lack access to basic health care. And I can tell you that it's not only the third world, or it's not only developing countries, even in countries like the United States, there's still some parts of the country that still lack access to basic health care and education. As a result, these communities face harsh realities in some disease states, like sexually transmitted diseases. They also have high child mortality rates. and basically malnourished. Some of the disparities are related to geography, with rural communities facing the greatest shortage of physicians and other healthcare workers. I think it is projected by 2030 there will be about 100,000 physician shortage in America, and you can extrapolate that to think about how many shortages of pharmacists would have, of nurses will have, but that presents opportunity too in those far-to-reach areas where pharmacists can play a significant role. All the disparities are the result of income inequality, with individuals and families simply unable to afford health care that is otherwise unavailable. Number 4 is political factors. By the time we add politics into the mix that we have in the global health opportunity, it just exacerbated. And as a result, within or between nations, due to war, it destroyed critical infrastructures for transportation, water, sanitation, and waste. Such average citizens become vulnerable to diseases. And this leads them to seek opportunities to flee, and this endangers their well-being. We saw what happened in Iraq, and we also saw what happened in Yemen. Refugee migration can allow illnesses to spread very quickly, undetected. Another thing we should be aware of is non-communicable diseases. As the world population ages and live longer, we're having people with more non-communicable diseases like diabetes, uncontrolled hypertension, and this accounts for 70% of all deaths worldwide. Some of this can be attributed to genetic, psychological, environmental, or behavioral factors. And education by pharmacists or other healthcare practitioners play a major role in helping to prevent deaths as a result of these diseases. Number 6 is animal health, food sources, and supply. As you know, some of our animals are now raised with antibiotics, and we also know that animals are vectors for a lot of all these viruses, and we can see that the animals are very important in the food chain. As we grow humans, we consume food on a large scale. In some areas of the world, animals are also relied on as for transportation, for draw power and clothing. In these communities, animal health is undeniably a factor in human health. Like we can see in the wet market in Wuhan and COVID-19. I think the spread started from people and the amount of uncooked food that they eat over there. The virus jumped from animal sources straight to human, and before we knew it, it was uncontrollable. And here we are today. The whole world is going through this pandemic. So things that affect agricultural practices, which may include irrigation, pesticide use, waste management, all of this can influence animal health and make disease transmission a concern at every stage of the food supply chain. Here in America, the cold chain, where food is packed, there seems to have been a very high infection rate of COVID-19 amongst workers. In some, as high as 70% of the workers that work in there. It might just be because of the coldness of the environment in which they work As such, it's easier for the virus to transmit and infect closely people that are working closely together. We've not been able to tie that to a science, but it is a concern, and as such, people are a little bit careful about the sanctity of the food supply chain. Some other things that we worry about in the world is antimicrobial resistance. A few weeks ago, I taught a topic on antimicrobial stewardship, where pharmacists, as gatekeepers of medicines, we play a very significant role in helping to reduce antimicrobial resistance in our community, so that the bacteria, the antibiotics that we have now can be effective, can be safe, and can serve us for a long, long time. Understanding that new molecules are no longer coming to the market as fast as they used to come. Also, there's weak primary health care, where we have very poor facilities, where we have no investment at all in some local communities. These also pose a threat to the global health. I talked about vaccine hesitancy earlier. There are some people that just don't believe that vaccines are effective. Some school of thought also think vaccines are responsible for giving their children autism. A whole lot of this that we pharmacists would have to educate our customers, our patients, in order for us to play a role in advancing global health for the population. But what is the current approach to global health at the moment? Or what are the results we're seeing? We know that the current approach isn't working. We know that science has made a lot of progress. We've been able to have new and powerful antibiotics. There is a lot of surgeries now being done. Some are even done robotically. Some there's really no contact between human and the patient. Of course, we have increasing application of technology to every area of healthcare. Here in the United States, most patient records are kept electronically. Most prescriptions that come from the doctor's office to the pharmacy are sent electronically. If you go to most physicians' offices, they're really they don't have any more papers lying anywhere in the clinics. And it is the same way we also want that to be in pharmacy as we continue to advance. The current health approach has helped us to improve human life expectancy and recovery from disease. However, we do have some opportunities that needs improvement around the world, because right now our approach is preventing us from realizing the full benefits of the medical advancement we have made. Some of that we will talk about transparency. We'll talk about how we share medical and patient records. We also know that our current approach is holding us back our true potential for progressing medical science to benefit everyone. Here is a slide that you can see. It highlights the opportunities in global health. We can start with a shortage of physicians and medical staff. That includes pharmacists, nurses, includes everyone that's involved in the medical team. We know that access is a big opportunity in the rural areas. Also, I think last week, my partner, pharmacist Emmanuel Omere, talked about rampant corruption in the global healthcare team. Here in America, we talk about federal anti-kickback statute. And I know in Nigeria too, there was a report recently about doctors getting paid for referral. I think one of the things that was mentioned that day was we spent about $5 billion since we started medical tourism to India, of which about $50 million of that found their way back to the pocket of doctors. So because of this corruption, it's costing is making the healthcare cost to continue to increase for everyone. We can see lack of patient engagement and empowerment, and this is the reason why we're switching from product-based care in pharmacy to patient-centered care. We can see lack of system interoperability. What this is talking about is, yes, we have gone electronic in our record keeping to make it easy, but the reverse is the case, because even with our records being stored electronically, we still have problem with sharing communication. There's lack of healthcare infrastructure. I talked about that shortly. Low quality of care, that we can see because we have issues with diagnosis. A whole lot of diagnoses made in some places are very wrong, and education is important to help us get past where we are at the current time. We're talking about issues in quality of care, inaccurate diagnosis, medical errors, and problem with medical practices in all countries at all economic level. It's not just in the third world. Even here, we see misdiagnosis, we see medical errors. It's not just in developing countries. We know that healthcare infrastructure is lacking across most regions in the world. Cost of healthcare is getting prohibitively high in advanced nations. I talked about health information is not managed or handled properly. Developing nations cannot afford the expenditure for implementing electronic health records. We talked about poor interprofessional communication due to flawed implementation of the electronic health records, resulting in health systems that fail to communicate with each other. As such, this does not empower patients, provide them more transparency. It also poses a challenge for everyone in the health field to be able to provide a better outcome for the patient. What are the impact of poor quality health services or delivery? There's some data here. 10% of hospitalized patients can expect to acquire an infection during the hospital stay. I think we call that nosocomial infection, and those are very, very difficult to treat. It requires a lot of resources. It requires very, very top of the range strong antibiotics to help us combat this. And because patients pick up hospital-acquired infection, it of course leads to them staying longer than necessary in the hospital. In America here, the cost of a hospital stay overnight or a hospital bed is a whole lot more than the cost of a hospital bed stay in the best hotel. It's more than the cost of a night stay in the best hotel in the world. So for every additional day that the patient has to stay in a hospital because they've acquired hospital infection, that also raises the cost of healthcare. We know that 1 in 10 patients are harmed during medical treatment. It might be the wrong site. It might be defective product that are used during the process. Some of this we see in defective valves. We also see defective mesh. We see defective products used in hip replacements, knee replacements. In the US, we know that more than 250 people die every year from medical errors. The broader economic and social cost of poor quality, including long-term disability, impairment, and of course, lost productivity, are estimated to run on to trillions of dollars every year. So let us review what we've talked about so far. We've tried to define global health. We've talked about it to be defined as globally of diseases and health situations that threaten the whole world. We've looked at medical and non-medical partners in the global health team, and these include pharmacists, doctors, nurses, everybody in the health team. It also includes sociologists, epidemiologists. It includes the government. We've talked about their interrelationship and interdependency. We've talked about them pulling their resources together and sharing information and helping for a better outcome in the global health delivery. We talked about the impact of poor quality services delivery, some of which we talked about people acquiring hospital-acquired infection. We talked about how many people die because of medical errors. So having reviewed all that, the question is, what role is there for a pharmacist or for a pharmacy to play in advancing global health? I'd advise that you take 30 seconds or a minute to think about that before we move to the next part and the crux of our presentation today. Okay, the pharmacist in advancing global health. Let us just define the overall goal that they play at the moment. Pharmacists are the third largest healthcare professionals in the world. A lot of us, but most of the time we're underutilized. We know that we're the most accessible healthcare provider. We're often the first healthcare professional individuals seek help for care. In some cases, it is in fact the pharmacist alone that is available to provide health care. Because of what we do, we can help reduce health disparities and achieve good health for all. And with the growing acknowledgement that global health is inclusive of local public health, pharmacists have established themselves as healthcare providers who also serve as global health practitioners. In the UK, we have pharmacist prescribers, so they do the whole 9 yards of the medical health delivery. They diagnose, they prescribe. And I know that here in America, you can have a privilege signed up by a doctor under which you practice, and you can also help in this case, if need be, to be a prescriber. In the pandemic era, especially with COVID-19, we've seen that pharmacists have demonstrated globally their adaptability, working tirelessly to stop the spread of COVID-19 and to ensure people continue to have access to medicines that they need. Here in the US, COVID testing is being administered by a lot of pharmacists, and we're getting ready for the vaccines that are coming up very shortly. Pharmacists are going to be a resource in helping to deliver vaccines and to patients wherever they're needed. This is the traditional role of pharmacists. We help to manage side effects of drug therapy. We assist in medication drug adjustment and drug review. We help to improve patient adherence. We help in providing advice regarding drug interactions. Pharmacists love that a lot. Patient counseling about their prescriptions. Providing advice to physicians regarding medication or patient drug therapy. Providing drug information to pharmacists, to physicians to assist in decision making regarding a specific patient's drug therapy, and dispensing prescriptions. There's an ever-growing and complicated variety of medications as such. Pharmacists are needed for education. We also are now in patient-centered care, in which we include services such as preventative screening, immunization, and disease state management. Because of this, we have less incidences of side effect and allergic reaction, less length of hospital stay, lower cost of health, and better outcome and improved quality of life. Here is a grid that shows the 8 principles of patient-centered care. Of course, we want patients to have access to care. We want them to have continuity and transition when they leave the hospital. We want involvement of family and friends. We want emotional support provided for patients. We want to make sure that wherever they are, they're physically comfortable. We want to continue to provide information and education for them. and we want to coordinate and integrate their care with physicians, with nurses, with caregivers. And of course, we want to respect what the patient preferences are. What pharmacists also participate in collaborative practice. An example is one here in which a doctor prescribes methotrexate for a patient 2.5 milligrams, asking the patient to take it daily. An experienced pharmacist will see that that in itself is not accurate. It shouldn't be taken daily. It should be weekly, because if it is taken daily, there are a lot of side effects that can happen, like mouth sores, skin rash, which could lead to patient going to the ER, and all of this cost a ton of money. Now we can see that there are many things on the part of the patient that will contribute to this. And the physician is a communication gap, and this gap is where pharmacists are expected to fill and play a role. Also, with the pharmacists as well, they need to have counseled the patient and probably review the history in order for them to be able to catch this error and improve collaborative practice. There's also disease state management, and I've always talked about pharmacists becoming specialists in disease state management. You can choose any disease state that you want to become an expert on. It might be infectious disease, it might be asthma, it might be hypertension, diabetes, and you can get certification and training on that, and you can become the person in the community that is an expert that doctors and patients run to for advice in these conditions. Of course, you can show your results, the things you measure, and by doing this, even the government are very quick to want to come and partner with you and remunerate you. Medication safety and pharmacovigilance. One of the biggest problems we have in developing or growing economy is substandard and falsified medications. And when you treat a patient with substandard and falsified medication, that poses a lot of significant health risk, because you don't know how the patient will react to the impurities that are in the product. Pharmacies are expected worldwide to be vigilant to try and stop the menace of falsified and substandard medications. This is where NAFDAC has done a great job in Nigeria by trying to sanitize the drug market. It's the same thing here too. If a drug is not approved by the FDA, it's not likely to get into the market. I think this year WHO is launching an initiative for global patient safety around in reducing avoidable harm caused by medication errors over the next 5 years. Roles of pharmacists continue with interprofessional linkages within various practice settings of pharmacy. What we're trying to say here is the pharmacist in retail should be interconnected and interrelated with pharmacists practicing in other areas of practice setting. And they can share information, share education, so that everybody is more equipped and ready to help advance the global health initiative. I think NAIP conference is going on right now. I was there yesterday. One of the things the initiative they have is academia to industry to help improve local manufacturing capacity and first to market. Sometime last year or 2 years ago, we had an Indian professor patent a drug that we know as Fagara. I think it's xanthosylum atoxyloides for sickle cell, which I know way back in the 80s, Professor Shoforda taught me that at University of Ife Pharmacy School. But because we don't have that partnership between academia and the industry, we failed to be the first to take that to the market. And things like this, that if we can partner and help to actualize these things in academia, we're very likely going to be able to increase manufacturing capacity, provide employment for pharmacists, and be taking advantage of all the opportunities that we have. One thing I want to say here is doctor-pharmacist collaboration. I want to congratulate the pharmacists in Nigeria for the federal government recognizing the consultancy cadre for pharmacists. Doctors have been consultants forever, but as pharmacists begin to specialize and fellowship, we're actually at that stage now where pharmacists are becoming specialists in specific fields that they choose to practice. What I like to say here is that we need to find a way to smoothen the rancor between doctors and pharmacists in Nigeria. Over here, everybody practices along their lane, and when we have doctors in the rural area where there are no pharmacists, they dispense. And when we have pharmacists in those areas where there are no doctors, they also are under the relationship with the practitioner. They can also become healthcare practitioners there. Roles of pharmacists: supply chain management. A lot of pharmacists now practice in supply chain. We have some challenges around there. We know the pharmacists have advantage of knowledge of drugs, but we have very limited knowledge of logistics. We can understand modeling, mathematics of optimization, movement of merchandise to and from manufacturer to shelf. We know these things, but we need more training. Be able to understand and maximize supply chain activity, and also help for us to know how our product get to us from point A to point B. An example is the cold room system. How long does it take for your product to continue to be effective and good if it takes 7 days to leave from one place to the other and is not stored in the appropriate place? So my recommendation is that pharmacy schools should at least include one module that teaches supply chain management, so that our new grads can be ready whenever they're done. We can also see in mental health and illicit drug use, pharmacists serve as managers and counselors. I think in the last few years, Nigeria has dealt with the codeine abuse, and pharmacists have stepped in a lot to help alleviate that problem and improve the public health. Pharmacists also set up drug abuse recovery units. They provide knowledge in treating and managing patients. Pharmacists are advocates, and they work with government in implementing goals and funding for these units and mopping up excesses of illicit drugs in the community. And doing all this improve the public health. Some pharmacists have mastered the art of volunteering. There are a few pharmacists I want to mention here that are going global for worthy causes. Dr. Nina Mezuwaba, PharmD, is one, and she volunteers with Mezu International Foundation. Mezu International Foundation, they do a lot of medical missions. They provide food and improve water resources for more than 500,000 people really in a year. They have collaborations with colleges of pharmacy here and medical schools as well. And they take their partners from here whenever they go to Nigeria to perform this volunteer work. We all know Dr. Teresa Pounds. She's a clinical pharmacist and nutritionist. She's very keen on PharmD. I think in Nigeria they call her the mother of PharmD. And she's very, very good in nutritional support as well. Hope Foundation and Dr. Babatunde Ajibade, we talked about quality of water. Dr. Ajibade and his team have been in Africa. They've been in Asia, building boreholes in communities that don't have access to water. And by just doing that, you can see that the public health of that environment improves. And of course, all NAPSA pharmacists, we go on medical missions every year. We've not been able to go this year, but we have participated a lot wherever we work in pharmaceutical services that has to do with the pandemic that is going on right now. Here is a slide that shows Mezu International Foundation in the things that they do. You can see the optometrist over there doing an eye exam. You can see food being given to participants. You can see a medical health team that is clerking and seeing patients. I told you about collaboration there, how we through US universities and Nigerian universities as well. And this brings me to my last section of this presentation, pharmacists in public health. With every pandemic that comes around, pharmacists have played a very significant role in dissemination of information and in bringing pharmaceutical care and services to the public. Public health is a branch of medicine that deals with public health, include hygiene, epidemiology, and disease prevention. The role of pharmacists is expanding beyond traditional product-oriented functions, and we're more patient-oriented right now. Some of our functions include administrative and public health responsibility and functions. Of course, the pharmacist's centralized placements in the community and clinical expertise are invaluable. Pharmacists offer accessibility. In some cases, some pharmacies are open 24 hours. Patients don't have to make an appointment to go see a pharmacist. This convenience gives us a window of opportunity in which we can provide public health services. Thereby, we fill a void related to access to care and prevention. Pharmacists provide information on self-management like hypertension, asthma, HIV, smoking cessation, and help to improve the health of the public. Pharmacists are public health educators. Some pharmacists teach in medical schools, and one of my colleagues in Nigeria, she's a faculty at, I think it's UI, the medical college. And I know some here too, we teach nurses, we teach physician assistants. And there's a growing need too for pharmacists to have knowledge in public health. As such, we know that there's a small number of colleges here that offer dual degrees of PharmD, Masters in Public Health. It is advocated that our schools in Nigeria too will at least introduce a module during the course of the student's life in the pharmacy school to teach public health, its importance, and the participation of pharmacists. Well, pharmacists also play a role in developing population-specific evidence-based disease management programs. We can start our own trials. We can start by collecting data. We can do contact tracing that is local to our area. And all of this data are used to help reduce risk of people picking up difficult conditions and diseases that are difficult to control. Pharmacists are strategic in assisting health surveys and advising people about and referring them to public health services. The importance of medication distribution and patient care during disasters is vital. During disaster period here, there are a lot of restrictions that are lifted. Patients can fill their prescription anywhere because shortages are very dangerous for people who have this non-communicable long-term diseases. Pharmacists also feel shortages of staff and during this period, and we're a welcome addition to the collaborative emergency team. And you can read a whole lot of the functions that pharmacists play in the public health. What we're suggesting, like I said earlier, is there should be greater inclusion of public health concepts in the curricula of pharmacy. We're also asking for increased awareness of roles of pharmacists in public health through dissemination of information in schools of pharmacy, schools of medicine, amongst policymakers. We also encourage transdisciplinary collaboration between all healthcare professionals. Pharmacists in public health provide education. They teach the public. I think Dr. Nina Waba last year taught, for the last 2 years, she's been teaching a course or a module on opioid abuse, the menace of opioid abuse. Pharmacists should participate in cold room construction and the sanctity of that. Right now, we have vaccine storage and administration that's coming on, because I know that the WHO is going to be sending some COVID vaccine to Nigeria when that becomes available. And pharmacists should be ready right now to be sure that they're getting their cold rooms ready, or they're getting their storage facilities ready, so that when these things come to the government, they are able to ask for some to be given to them so that they can help administer vaccines to people that need them. Pharmacists also can play a role in contact tracing from your store. You can do that and help public health awareness programs. So, a summary of what we've talked about so far today. We've defined global health. We've talked about the medical and non-medical partners and their role. We've talked about current approaches and opportunities in global health. We talked about the effect of poor quality health services delivery. We just discussed pharmacists' roles in advancing global health. And we talked about the importance of the pharmacist in the public health. I hope today, after this, you would go back and review your role and understand that you play a significant role in advancing public health. Maybe in retail, where you're constantly giving advice and counseling patients on the effective and safe use of medicines. Maybe in the industry, where you are helping to manufacture products and make their way to the market. It might be in academia, where you're teaching and providing education to our pharmacists or to our doctors or to our public policy people. And it might be in administration and advocacy, where you're talking to the government to try and get more funding and resources to help advance pharmacy participation in global health. I hope I've been able to make some point this morning, and I wanted to make some.
Dear colleagues, we had two questions that had come in. I have shared them with Dr. Tumeti. Dr. Tumeti, would you like to take those questions quickly?
Yes, I would take those questions very quickly.
Great.
Hold on a minute, I think I had them. The first question was, let me look for it again. These are two questions. Pharmacists in community practice are not yet included in the public health infrastructure of Lagos State. So outreaches and interventions are not supported by government. Is there any learning we can take from local context in your city or somewhere that can help us chart a way forward for recognition and remuneration for some pharmacists delivered services? The second question is there a way community, hospital, industry pharmacists, and academics can form collaborate to show impact of pharmacist-led service we can share. Seems we need it for great questions. And I think, let me take the first one about non-remuneration of services that is rendered in the public. I can tell you that even here, that we seem to have organized health plan. The first thing that I would ask that we do here will be advocacy. For instance, the Lagos PSN would start by defining what kind of intervention that the pharmacists want to participate in. And once you define that, you define the goals, and you're able to measure the success you've provided. You can then take that to the government. Once you can show that you've been able to show some results because of your intervention. An example is and we have the children, or you have every asthma patient there is using 2 canisters of a rescue inhaler every month. Standard dose of albuterol. I forgot what you guys call it over there. I think it's albuterol or whatever. It was Ventolin. The standard dose for that is 2 pours needed for shortness of breath. So even if a patient is using it every 6 hours, a canister would be 200 divided by 12 will be about 18 days. So if a patient does intervention program with this clinic, and 3 months later, we're seeing that the patients are no longer needing or using their rescue inhaler as often. I mean, people go down from 2 canisters a month to 1 canister every 3 months. You can show that you've been able to improve the patient's health condition by your intervention. By doing that, you are able to take those results and take it to government in advocacy and show the work that you've done. And by showing that work, the government they're not unreasonable, because they know that when your intervention improving the health outcome of the people, they're spending less money. And because they're spending less money, there is some money there to spread around and remunerate the pharmacists for every time you do an intervention, like we just talked about, you must document it so that months and years later you can show from where you started, that you can show the effectiveness of what you've done. So there are many disease states in which you can participate in and show your effectiveness. You might decide to work in an HIV, you might decide to work with a clinic that's an HIV clinic in which patients are not compliant with their medicines. By just improving compliance and helping them improve their T cell counts and keeping them away from hospital, you can show that the government is spending less money, and there's just a fixed amount of money that the government can spend. If you're helping them save money in one end, then they have enough money in that bucket to remunerate you for the work that you're doing. So advocacy is important in that. Also, you also have to document your intervention. The second question, I'll answer that by saying you can start really in your own small locale of your pharmacy. Find a willing doctor around there. You actually also try to find a lab, antimicrobial stewardship, or you're interested in infectious disease. All three of you can pull your resources together, share your patients, share your data, and show the effectiveness of the intervention you're doing. But you have to get results first before you can be able to go out there and seek for compensation. Advocacy is so important because only until a few months ago in the United States, pharmacists can give immunization for children up from the age of 8 and above. Well, because the pharmacists in America have pushed and pushed and have shown effectiveness that they're able to deliver that service of immunization and disease prevention. There's a new law now that allows pharmacists to administer immunization, vaccination to children 3 years. There's a whole lot of work to be done in collaboration. There's a whole lot of work to be done in showing effectiveness for your intervention before we can then go to the government and seek for remuneration. Thank you.
Yes, Kenny. Good afternoon once again, everyone. I hope everybody has been, you found this session insightful so far. Okay, we have our second speaker, Pharmacist Adekola Wojoola. Pharmacist Adekola Wojoola, BPharm, MPSN, is an accomplished pharmacist with over 18 years professional experience. He has served in various capacities in GlaxoSmithKline, a global pharmaceutical and healthcare giant, over the last 12 years. Under his watch as Group Product Manager, vaccines, the GSK Nigeria private vaccine portfolio experienced double-digit growth in 2016 and 2017, during which he launched key brands in nature portfolios like measles, mumps, rubella, and varicella, that is Paris, etc., hepatitis A and B, Twinrix junior and adult, a combination vaccine, as well as meningitis, Menvio. In 2017, he held value of vaccine training for over 100 HCPs in meetings across Nigeria and his cascade of the International Papilloma Virus Conference, IPVC. 2007 version was recognized as the best in sub-Saharan Africa. He has also overseen the national distribution of vaccines as a channel development manager. As an independent consultant, he currently runs a monthly podcast, Preventive Health Nigeria, with an audience across 15 countries. He also facilitates vaccination. In the business context, training for pharma organizations interested in venturing into the private market vaccines. In August 2019, he facilitated the masterclass for vaccination at the PSN Lagos Scientific Lagos. You're welcome, sir.
Thank you very much, Adela. I want to confirm if I'm being heard, please. Can you confirm that, Adela? All right, great. Okay, thank you very much. I've been having fun since morning. Thank you very much for that introduction, Adela. Thank you very much, Tometi from United States of America. That was a very exhaustive one. As a matter of fact, you've made my job very easy. So in the next 20 minutes, we want to be talking about unlocking vaccination in community pharmacy for the benefit of Lagosians. All right, so in my capacity as a consultant for vaccination, I'm going to be talking to you about this, but I know a number of people here know me as the Managing Director of Mega Health Care Distribution Centers, PLC. So we want to talk about vaccination. And the first thing I want to bring you up to speed on, just a minute, please, is to tell you about my flow. The flow is I'll tell you about the value of vaccines. We examine today's realities and we look at overcoming low vaccine uptake, the role of pharmacists, and then we will round up by looking for opportunities for pharmacy-based immunization in Lagos. Okay, so this man you're seeing here, his name is Plotkin, and Last month, I was privileged to meet him on an online platform. He's a very well-known name in vaccines all over the world, and he has this to say that with the exception of safe water, no other modality, not even antibiotics, has had such a major effect on mortality reduction. How come Plotkin can make such a claim? The WHO confirms that more than 2.5 million deaths are prevented by vaccines. That means the deaths that are due to vaccine preventable diseases. And there's a whole list of them, about over 35 of vaccine preventable diseases that we have today. So picture 2.5 million as the population of Jamaica. Jamaica has about 3 million people in that country. So you can imagine a population of Jamaica being saved from dying every single year. That is massive. That is massive, and it's only vaccines that have been able to achieve that feat. And congratulations to Africa. Just a few weeks ago, I think 25th of August to be precise, Africa was declared free of polio by WHO. I want to give a round of applause to everybody, our nurses, our pharmacists, everybody in the healthcare team, especially in Nigeria. You know, it used to be Pakistan, Afghanistan, and Nigeria that were holding the whole world back with cases of white polio. But I'm happy to say that Nigeria is out of that bracket forever, and that's a big achievement for us all. So what other kind of intervention is able to wipe out a disease like vaccines? You remember that smallpox was wiped out, was eradicated from the face of the earth in 1980. That is what vaccines can achieve. All right, now I want to show you, if you see my screen properly, you can see that in terms of contribution to life expectancy, vaccines contribute much more than antibiotics. All right, I know Nigeria is an antibiotic market. I know that well over a quarter of what we do on a daily basis, all of us, is to dispense antibiotics or to prescribe it as the case may be. But you can see that right from when smallpox vaccine came in, you can see the influence smallpox vaccine had on increasing life expectancy in the 1980s. You can see when rabies vaccine was introduced and when diphtheria vaccine was introduced. Compare that with antibiotics, which is in purple. You find out that altogether, vaccines, antibiotics, and hygiene are contributing to increased life expectancy, but vaccines are doing much more. So what that means is, as a pharmacist, I really need to know about this other intervention, which is preventive in nature, which is doing much more than antibiotics. Now, I'm very happy that Pharmacist Dominique talked about antimicrobial resistance. Now, that is a big word. Anywhere you go all over the world, AMR is a big word. Now, I was privileged to see a study where Neisseria gonorrhea has become a very big problem in the United States. Almost all the pharmacological interventions, almost all the drugs that are being used, antibiotics, are no longer working. All right. So what the smart scientists are doing now is not to keep looking for other antibiotics to fight gonorrhea. What they've simply done is to look at the strain that is resistant, and they've worked on a vaccine that can just prevent the strain. Can you imagine that? 72.9 reduction, percent reduction in antibiotic consumption in the United States just because of the introduction of the pneumococcal vaccine. In other words, you know, the pneumococcal vaccine was introduced in Nigeria, going about 6 years now, is free of charge. Thanks to the Global Alliance for Vaccination and Immunization and bodies like GSK. And now every child in Nigeria is getting the pneumococcal vaccine free. Now, the reality is that our antibiotic use in the next couple of years is going to reduce. And that is a plus to us, because anytime you reduce the use of antibiotics, what you are doing is you are trying to reduce the impact of the antibiotic doomsday, which we know will come one day. So that is one reason why you as a pharmacist should know more about vaccines, so that we can reduce the use of antibiotics. Now, talking about vaccines and antibiotics, you can see that vaccines control diseases quickly and for a longer time than you know, antibiotics do. So For example, you all recall that when you were young, when you were a baby, you took the BCG vaccine. And how many people have repeated the BCG vaccine? None. But that BCG vaccine is still working in your body. But the tetracycline you took when you were young, you no longer can take it now. So what that means is, even though antibiotics generate resistance, vaccines are able to suppress diseases and eradicate them and stay in the market for a longer period of time. Another thing you need to be aware of is the economic impact of vaccination. All right. So somebody said something. He said for every $1 you invest into vaccines, you actually save $18. All right. So a country like America has been able to do a summary and to find out what they are saving from just vaccinating everybody against chickenpox. Now you can see the net savings are huge, because just like Pharmacist Dominique mentioned, you see, when a child does not have to go to the hospital for rotavirus diarrhea simply because he has taken a rotavirus vaccine, what you have saved that child is not just the sickness. You have saved the mommy from staying in the hospital. You have saved the economy of that family. And when you multiply that in multiple fold, you can imagine how much the country will be saving if every baby does not have to go to the hospital to take diarrhea care, to be admitted in the hospital, loss of work hours, and so on. So countries that are more advanced than Nigeria have been able to put this into context when it comes to savings. So we have seen the fact that vaccines are able to increase, life expectancy, and they are able to improve life quality. They are also able to, reduce the use of antimicrobial, agents. But let's look at the present realities. How are vaccines being embraced in this part of the world and even globally? But before I do that, I want to show you something. This is a very disturbing slide. Why? Because apart from antimicrobial threats, it seems as if humanity is going back into the infectious disease age. Why do I say that? You see Ebola there. You see Lassa fever. You see Zika virus. You see coronavirus. You see the bubonic plague. You see all these things either newly imagined or reimagined. All right. And just like I've already painted a picture for you that if we keep using antibiotics for all these things, there's going to be a day, as a matter of fact, and by the 2030s, it's estimated that we're going to hit a zone where most of these infectious, anti-infectious agents that we use might no longer be working. That's a doomsday. And so the only saving grace is vaccine. So as a pharmacist, as a professional, you must, it's not an option any longer, you must know about this life-saving agent, and you must, familiarize with them. Familiarize yourself with them so that you can save more people. Unfortunately, in Nigeria, even though the diphtheria, pertussis, and tetanus vaccine, which is given as a combination to children under the age of 12 months, they take it 6 weeks, 10 weeks, 14 weeks. It's unfortunate that even though it's free, babies are still not taking it. So if you look at this graph, you can see where Nigeria falls. You see that less than 50%, between 50 and 79%, which is far below the cutoff mark of 90%, is what we have as a current coverage for vaccines. This is 2019 data, and it's WHO. So what this means is, in a country like Nigeria, even vaccines that are very free of charge, you only need to walk in there and take your vaccines, we are still not taking it. And the implication of that is huge, because the kind of diseases we are still fighting with, antimicrobial agents, we could have saved that money to do some other things. There's no equality between a child that is born in Nigeria and a child that is born in the UK, because a child born in this part of Africa is 30 more times to die before his 5th birthday than a child born in UK. So there are huge implications to this as I speak. Another reality is, vaccines are emerging, all right? I know that when we all went to pharmacy school, several years ago, and, while we're growing up, we all had this notion that vaccines are only for babies, but that has changed. The WHO is now driving what we know as lifelong vaccination. All right, so all these diseases you see on the right of my screen, from hepatitis A to human papilloma virus to rubella, chickenpox, meningococcal disease, and so on and so forth, are vaccines. They all are vaccines, and they are meant for adults. All right, so there's a vaccine for every age. So the current reality we are living in is any age you can be, whether you're a child or whether you're a teenager or you're an adult or an elderly person, there's a vaccine for you. And the reality is that certain health conditions will predispose you to certain vaccine preventable diseases. For example, diabetic patients, which I know all of us see as community pharmacists, have a predisposition to hepatitis B. So what that means is every diabetic patient you see, you ought to recommend hepatitis B vaccine. But if you don't know it, you are losing, your relevance as long as you are limited to the curative level of medicines rather than the preventive. Okay. Another reality is that the defense against vaccines are growing every day. All right. Now this is a very recent. This is a very recent. Publication, and I'm privileged to have it because of the circles I work in. You can see in Nigeria, right here in Nigeria, 4 out of 10 Nigerians have said, I'm not going to take COVID-19 vaccine even when it comes. And so that just makes you think that, so how come humanity has gone through all this stress of trying to get a vaccine? As I speak to you, about 6 vaccines are in the phase 3 stage, and a lot of money and a lot of investment is going into this. China is trying to outdo US is trying to, and Russia is trying. But here in Nigeria, we are saying we will not take the vaccine. Guess what? We need somebody to advocate and tell people the story you are hearing about vaccine is not true. If not for vaccine, we would not have eradicated smallpox. If not for vaccines, we would not have eradicated polio in Africa. So somebody needs to tell people the real truth, all right? So let's talk about overcoming low vaccine uptake. Let's look at the role of the pharmacist. All right, I have just a few slides to go. All right, now I've shown you that Nigeria has a poor vaccine uptake, and the question is how, as as pharmacists, what can we do to, to make sure that we improve this situation and we deliver more value based on what vaccines can do. So what I've tried to do is to look at the reasons for low uptake of routine vaccines. Of course, we have the political there. If the government is not spending enough money now, Nigeria is still taking free vaccine. What? Let me just define this. There are 2 types of vaccines. There's the public ones and there are the private ones. The ones that are public are the ones that are reimbursed by government. All right. But the Nigerian government is not solely responsible for all these vaccines that babies are taking free. There is a global alliance for vaccine and immunization with Bill Gates and a whole lot of people are involved in that are supporting. So naturally by 2020 or even by last year, we're supposed to have left on the range of countries that are still being sponsored by bodies to donate money for us to vaccinate our babies. I mean, it's ridiculous that with all the oil money and all that we have. But you know what Nigeria did? Nigeria went to plead again. We pleaded with the with the world bodies and said, please let us still stay in this free. Let's just get it free and so on and so forth. Don't get me wrong, Nigeria is still donating some money, but countries like South Africa don't take all this support that we are enjoying. So political will sometimes make vaccine shortages happen from time to time. So that is sometimes responsible for a low uptake. But very also to the right, you see the infrastructural challenges. Of course, we know that logistics is a major challenge with vaccine. You have to keep it cold and you have to maintain 2 to 8 degrees until the time it is injected into the patient himself. So from the manufacturer down to the patient must be maintained, and that's a challenge for us in Nigeria, where most places don't have 24-hour power supply. But while we have the political and infrastructure being some major challenges, the most challenging reason why people don't take vaccine is because of social reasons. I just showed you a survey that was taken right here in Nigeria, all over the world, and people have misperceptions, and people have preconceived ideas, people have fears due to lack of trust of vaccines. So the question is, as a professional, is there anything we can do You and I might not be able to change the political will. We might not even be able to change the infrastructure. But as community pharmacists, as professionals, is there anything we can do about the social roots of lack of use of vaccines? The question is yes. All right. So I want to show you this to show you that there are many things that influence individual vaccination decision. For a woman to carry his child and go to a public health facility and go and inject the baby, there must be something driving him or her rather. So there are political, social cultural context. Okay, up there in the north, fewer people take vaccines than down in the south. Communication, social media. Social media is becoming very, very powerful. Whatever you see in the social media, people don't even double check, they just believe it. All right, so we can use that either in a positive or in a negative. Of course, we have the policies. If the policy says nobody can enter this school except is vaccinated. Australia was trying to do that with COVID-19, but I think they changed their mind. So all this influence individual decision making about vaccination. But the most important one, which is in red, is the healthcare professional recommendation. You and I, because of the kind of trust people have in the profession, I'm sure a lot of you that run community pharmacists are able to gain the trust of these people because they know that when you're saying something, you're saying it for their good. So how much are we using the kind of influence, the kind of power we have over our patients to help them to take vaccination decisions? All right. So the question we'll ask is, why is a pharmacist relevant in immunization? One of the most important reasons is what I said the other time, and Pharmacist Dominique made the same point, okay? As one of the most accessible healthcare professionals, in fact, people come to us before they go to the hospitals. So how are we using that advantage to help the country to better immunize more babies, better immunize the community so we can have a healthy population, all right? A healthy population is a wealthy population. That has improved in anywhere. I always make this analogy. If you travel out of the country and then you spend a few days or a few weeks there, you don't see people limping and you don't see polio cases. But when you cross over and you get to Murtala Mohammed Airport, I can bet you the first set of people that will welcome you when you get to your baggage area after you get out are people that are limping. Why? Because Nigeria didn't take a decision early enough, or because of uninformed choices, people are not taking it. And so because we are the first set of people they see, we have a whole lot of power. Okay, I was talking to a professor and I told him that in Nigeria, pharmacists, vaccinations are not being done in pharmacies and pharmacists are not able to vaccinate. He came from Belgium and he was embarrassed. He said, Kola, you mean that? Why? For what reason? He said, it doesn't make any sense in the world. Why? Because pharmacists have the power to get these things done. So also because of the privileged positions we have, we can see a lot of prescriptions. We can see, the pattern of diabetic patients and so on and so forth. We're able to identify the groups that need to be vaccinated for certain diseases. Also, we are in a very good position to allay the fears of many patients that do not want to be vaccinated. So that's why we are very important. So let's talk about the impact of pharmacist vaccination participation in upper and middle income countries. Now, in the United Kingdom, about 1.3 million doses of vaccines were taken in 2017 just because of pharmacists, which was about 10% of flu vaccinations taken in the United Kingdom. The same thing in the United States. That should tell you that because community pharmacists record a whole lot of, cases of footfalls on a daily basis, they are very, very influential in making people take vaccination decisions. Now, current situation in Nigeria, all right? Now, this is a study that shows that pharmacies are being studied by the Nigerian government, and they've been seen as a possible center for routine immunization. This is as far back as 2012. All right, and they've done the study, so it's only left for somebody to press the button and say, all right, go ahead and vaccinate. But like what Pharmacist Dominique said, he said every single advancement in pharmacy they made in the US was because they fought for it. We cannot sit back and say, well, Nigerian government says we cannot vaccinate, which is still in gray anyway. we must fight for. If we want to vaccinate, nobody will come and call us in our houses or in our practices. We will be the ones to say we can do it. And I'm showing you a study that shows that the higher the density of workers you have, the more you are able to reduce maternal and child death. We all know how many of our colleagues that have gone to Canada, doctors, nurses, pharmacists, and so on. The little we have is better we make use of it so that we're able to reduce child mortality. So legislation is still in the works, but to a large extent, we are the ones that hold the aces. So very, very important that we know that as many as are in a position of authority, let's fight for this. Let's get pharmacists to be able not just to have vaccination in their pharmacies, but also to vaccinate. It's very, very important. I want to show you in the next few slides that I showed you the slide on adult vaccination the other time. A lot of adult vaccinations are coming on now. In the United States, you have the shingles vaccines, you have the pneumococcal vaccines for the elderly, and so on and so forth. Now, because many more vaccines are coming on adult vaccines, the best place you can get people to take adult vaccines are in the pharmacies. All the vaccines I've taken as an adult, I didn't go to the hospital to go and take it. So everybody is excited about COVID. COVID vaccines will come into Nigeria and you'll be amazed at the uptake. I can tell you, you can quote me. Who is talking? I was in a meeting where people came from all over the world and they were asking, please, what has Nigeria put in place to make sure that adult vaccines are being taken so that when COVID comes, every member of the family will have to take it, not just the baby. If we do not get pharmacy-based immunization right in Nigeria, we are not going to move with the rest of the world in terms of preventing antimicrobial resistance and recording all these successes. Now, but the good news is because of all these challenges of COVID, I want you to see the challenges and the opportunities now. So there's a whole lot of a whole lot of pharmacies are now being perceived as safer zones. People would rather go to the pharmacy than go to the hospital to get treated for obvious reasons. During the COVID vaccine period, a lot of children were at home and they were available for vaccination, all right? Then the internet traffic has really, really increased. These are opportunities for us. People are coming more to us and people are searching the internet for health information more than ever before. All right. On the other hand, disadvantage or the shortcomings of the COVID period and this period we are in, there's a whole lot of anti-vaccine campaigns going. I've just shown you that. Then there's a fear for safety of both vaccinator and vaccinated. That's unfortunate. And in terms of economy, people have lesser amounts to part with. So, but the pros actually overcome the cons. Why? Because we have more people coming to us because they trust us. And so let me just state what the opportunities are for us and the low-hanging fruits. Every pharmacist that I'm talking to has a social media platform. You have your personal one and probably you have the one for your pharmacy. What are you doing with it? Because the insight we are gathering is that people are believing everything they are seeing online. And if more people are going online to do everything, to shop, to do everything, to get information, you can imagine how many webinars you have been to this week. And even I've had a webinar this morning. I've had a meeting online. I'm having one now. I'm going to have another one. Okay. So everything is online now. What are you doing? What is your strategy? Your strategy should be to lead efforts aimed at making valuable immunization information available online. Drive traffic to your pharmacy by putting information on vaccination on your website or even on your personal social media space, your Instagram, your Facebook, and so on. When you do that, people will come and ask you for it, and then you can harvest them for vaccination. The other insight is people care for their families, but they are afraid also that vaccines can cause harm. So what can we do? Because a lot of people, the opportunity there is that because a lot of people visit our pharmacies on a daily basis, and I mean an average of 50 in a small pharmacy, up to about 100 in a big pharmacy. What are you doing? Why people are on your shop floor to make sure that you're educating them on the value of vaccines? So these are the kind of information. Now, we might not have the legislation ready, but there's a whole lot we can do. You can do the education. And then my final slide. There are a lot of challenges you must envisage by the time you want to venture into vaccination as a pharmacist. One of them is logistics, and another one is the fact that people need to test. All right. All right. I'm rounding up now. People need to do tests. If you are going to do adult vaccination, people will do hepatitis B vaccine, and they will do a human papillomavirus vaccine, test. So you must know that you got to collaborate. That's where I'm going. Collaboration, collaboration, collaboration. Everywhere in the world vaccination is being done is because of collaboration. In a case where a pharmacy says, I will get the patient, I will inject them, I'll get all the money, it's not going to work. Now, see what I recommended. Work with other HCPs. Work with the hospital next to you. All right, the law says I might not be able to vaccinate, but can I send the people that show interest in vaccination to you, and you take a particular cut, I take a particular cut. Let's sign a MOU. What's stopping us from doing that? You must work with labs. You can't do everything yourself. You can't have the lab, have the nurse, have everything. You don't need that. Why don't you focus on demand generation because of the strategy you have, your online strategy and your physical presence strategy. All right. So all right. So I'm done, and very, very important. There's still a whole lot of things to talk about, but let me just summarize and go. The need for more vaccination awareness is underlined by the fact that the world seems to be re-entering into an infectious disease age. Number two, the pharmacist is key to achieving better adult vaccination coverage. We have seen that. And number three, the Lagos pharmacist can take advantage of the opportunity of social media, also take proactive steps to make sure that potential vaccinees in his or her pharmacy becomes risk aware of vaccine preventable diseases, and now drive the commitment towards immunization so that we all win together. And once again, I want to wish you a happy World Pharmacist Day. I hope you got something out of this. Please work on it. I'm always available. All right. My consulting firm can assist you in drawing up strategies for your specific pharmacy. The vaccination and business context training still works. And very, very importantly, I hope to see you on the Mega Medex platform, placing your order. Thank you very, very much. Thank you.
Hello everyone. Not to take much of your time, like you've stayed this far, we would like to introduce our top speaker, and he's already with us here. Farm Oni Israel, aka Farm Radio. He's the founder of Farm Radio, an online social media platform where health and drug information is being disseminated. Oni Israel is a pharmacist with over 3 years experience in the community practice who uses the social media platform to give information on health and drug use in simple, understandable terms to the public in order to promote the safe and responsible use of drugs and general well-being. He has been a guest on several mainstream media and spoken for multinational companies. He is an alumnus of the University of Lagos, where he earned his B.Pharm degree. He also has 9 awards to his name in recognition of the service, impact, and professionalism, while as a student, and an award for professional conduct presented to him by the student body and the Dean of the Faculty of Pharmacy, UNILAG, respectively. He has certification to his portfolio, namely Data and Health Indicators in Public Health Practice by Johns Hopkins University through Coursera. Also, he has pharmacy in psychiatric training workshop for Nigerian pharmacists. He currently works as a community pharmacist in Lagos and is very passionate about health information dissemination in order to improve the quality of life of Nigerians and the world at large. Let's welcome from Oni Israel.
Okay, without wasting our time, let me just go on while you're sorting that out. So I'll be talking on speaking on medicines information service for the benefit of Lagosians. First of all, let me make us understand that information, they say, is power. Once you have the right information about something, you have the right knowledge about that thing, and you get a full grasp of what the thing is all about. Information can be in form of a message that is being passed from one person to the other, just to get the person to know more about that thing. So medicine information also follows this part. Medicine information service is like a specialized service that is being provided by pharmacists. Keyword pharmacist. Medicine information service is a service that is being provided by pharmacists. Pharmacists are actually the medicines experts, drug experts. We are the ones that really know what a drug is all about. We are the ones that give information on what the drug is supposed to be used for, what the drug is not supposed to be used for. So it's our duty and responsibility as pharmacists to be able to give this medicine information to the general public, to other healthcare providers, and what have you. So before I move on, let me see if I have access to share my slide. Okay, I still don't have that. I'll quickly speak on the benefits, the strengths, the threats, the opportunities, the weaknesses we have in medicine information service in Lagos. I actually had the opportunity of carrying out a survey. I carried out a survey recently which involved about 137 pharmacists that practice in the community, the hospital, and other fields of pharmacy. From my survey, I was able to find out that about 60% of the people that answered my questions during the survey were practicing in Lagos, and then about 40% of them. So as I was saying, I was able to carry out that survey, and I noticed that out of the 137 pharmacists that I was able to interact with to ask them questions, only about 16% of them had functional DICs in their facilities. What I mean by DICs is drug information centers, where the medicine information service is supposed to be carried out. Only about 16% had. Okay, I can share my slides now. Okay, let me quickly move. So I was talking about the results I got from the survey I carried out. You can see from the survey I carried out here, 60% of people that answered the questions were practicing here in Lagos, and then 40% were practicing outside Lagos in other states in Nigeria. And then the area of practice, we had 65% of them in the community practice, and 15% of them in the hospital practice, while the remaining 20% were practicing in other areas of pharmacy. But you will see from the last chart in that result, only 17% had a functional drug information center in their place of practice. 17%, while 83% did not even have anything called drug information center in their place of practice. And that is a very, very serious problem. If we say as pharmacists running different practices, we do not have drug information centers in our area of practice at this stage, at this point in time, it is a very, very serious problem. And that will take me to the next slide, which talks about the weaknesses and the strength of medicine information service. So let me just talk about the weaknesses first. The weaknesses I've noticed over time in delivery of medicine information service is that many pharmacies do not really have the interest in this service, medicine information service, which is actually a very, very serious problem for us. If we as pharmacists are not showing interest in giving information about medicines, teaching the public, making them acquire knowledge, other healthcare professionals, making them understand what drugs are supposed to be used for and what drugs are not supposed to be used for, is actually a very serious problem. And then from the results I obtained from the survey I carried out, we'll notice that unavailability of DICs in places of practice is actually another problem we have in our practice for medicine information service. Now, if you look at the strengths I listed out there in my slide, you see that these are the things we are missing out by not having a functional drug information center in our practice. The strength of medicine information service, some of the strengths are what I've listed out there: increasing community knowledge on drugs and drug use, improving patients' adherence. If a particular patient has the vital information, the information the person needs about a particular drug, you'll notice that adherence to that particular drug is optimized, adherence to that particular drug is achieved. And then if you as community pharmacists, like the other speakers have said, community pharmacists, basically pharmacists generally are like the most accessible healthcare providers in the world. We tend to see a lot of patients on a daily basis. If after seeing a particular patient or different patients on a daily basis, we cannot give them information about the drugs we are dispensing to them, that trust is will not be optimal. So if we can, as pharmacists that we are, we can try to utilize this opportunity of disseminating information to every patient we see at every point in time, at the point when we are giving them their drugs, tell them what the drug is all about, tell them what to expect, give them information about their drugs. We'll notice that the patient-pharmacist relationship will increase in that way. And then we also notice that some of the strengths of medicines information service is that it minimizes medication errors and adverse drug reactions. Like I said earlier, this information we are giving is not just to the public, it's not just to the patient. The healthcare providers also are part of the people we are supposed to give this information and knowledge about these drugs to, so as to minimize medication errors, so as to minimize issues that has to do with drugs. And then by doing that, mortality rate is also reduced. The last point I gave there concerning the strengths of medication information system service is that it helps curb drug resistance. It helps curb drug resistance in the sense that once the community or the public at large has the proper information they need about the particular disease state and then the drugs they are using, there is it helps to reduce the abuse or misuse of that drug, hence reducing drug resistance like antibiotics, like our other speakers mentioned earlier. Let me quickly move to the next slide. Now, the threats I've noticed in not having a very good medication information service in your facility is that I've noticed over time is that many pharmacists are quite reluctant to change and development. The world is evolving, things are changing, everybody is moving fast. So also the pharmacy profession has to move and evolve and change rapidly with the world, with the way the world is changing. Because if we do not come to terms with this, we'll be left behind. If we do not realize that now is the time to move, now is the time to do what we're supposed to do as pharmacists and healthcare givers, we'll be left behind, and then our profession will suffer for it. Because if other healthcare professionals and the public is not seeing the relevance of pharmacists in this aspect of medication information, it's just a matter of time. We'll be sidelined, and we wouldn't want that to happen. So that brings me to the opportunities that medication information service brings to the profession and the world at large. Opportunities such as education service to healthcare professionals and patients, like I mentioned earlier, and then it also helps to provide comprehensive resources for research purposes. Like I mentioned earlier, when we do medication information services like this, we are able to determine when a particular drug has a particular adverse reaction. And when we do this for many other drugs, we are able to get different data. We're able to get data, collate data, use this data for research purposes. And you know, all these are they are intertwined. If you can get all this done the right way, we know that this data we are getting, we actually have a long way to help the global health at large. Let me move to the next slide. The next slide are now the actions that I think we should take as pharmacists to make sure our medication information service does not suffer. The actions we need to take, we have to be deliberate about updating our knowledge as pharmacists. We have to be deliberate about it. We have to want to know more. We have to want to challenge and be challenged. We have to update ourselves with adequate information that will help us carry out this medication information service properly. We have to equip ourselves with different resources, materials that will help us be able to give the adequate information to the public and the other healthcare professionals. We also have to try to create drug information centers in our premises. I know many community pharmacists will want to say, okay, my community pharmacy, how do I want to create a a drug information center in a community pharmacy. It doesn't have to be a building. It doesn't have to be an apartment on its own. You can just get like a small section of the pharmacy and then stock up books, materials, references, research books, research papers that will enhance, that will help the practice in terms of medication information, that will help us have the everything we need to be able to give out information, adequate information, correct information to the public and the other healthcare professionals. And then last thing I'll speak on is to leverage on internet, to leverage on technology. Like our last speaker said, social media is actually a very, very, very powerful tool that many of us are not tapping into yet. Many of us are not tapping into the social media power yet. A lot of things are happening in social media. A lot of things are really happening in social media, and we can actually make use of this to our own advantage. We can make use of this, use the social media to disseminate information, talk about things, about drugs, about what you do as pharmacists, about vaccination, about information the public needs to know about drugs, because many people are actually being misinformed. And then you also agree with me that a lot of lives have been lost because of misinformation. Many people don't understand that when you overuse or misuse an antibiotic, it can actually cause you more harm than good. It can actually also cause harm to people living around you that are not even using the antibiotics with you. All this information are things the general public appreciate. We may not know that they are appreciating it, but if you constantly and you are consistent about giving out information like that, before you know it, you're already building a network of people that will always want to come to you for information. And we as pharmacists, we are in that position to give out this information at every point in time, because we are the drug expert. Because the way things are going, a lot of people are misusing and abusing drugs. A lot of people are actually, this pandemic period, a lot of people are panicking unnecessarily, going out there using drugs anyhow. So these are opportunities for us. We are supposed to see all these problems as opportunity to actually be better, to do better for the profession. And as we all know that the World Health Organization has defined health as not just the absence of disease or infirmities. Health actually has to do with your physical, your mental, and your social well-being. If all these things that have been said about medication, drug service, and providing drug information centers in our respective place of practice, if we do all these things, you will notice that all these things actually aligns with the definition of health by the World Health Organization. Because all these things, when we come together to try to make these things work, we'll notice that this, with time, it will help transform global health towards achieving health for all. And I hope the few things I've said will be able to make the necessary change. Thank you so much for listening to me. I appreciate it all.
One says, how can I start the vaccination service in my pharmacy at Ikota? Is that the one you're talking about?
Yes, that was the question that came in.
Thank you very much. So, dear pharmacists, what I'll say is that starting a vaccination service, my last slide kind of showed a whole lot of dependencies, a whole lot of collaborations. And what I would say is that the first starting point is you yourself and any other pharmacist that's in your employment or your sales or the people on your shop floor need to be educated on the value of vaccines and the use of the vaccine schedules. There are a whole lot of things that you need to be trained on. It is when you are aware and very, very grounded in these things that you will be able to, put forward a strategy to make sure that people are taking the vaccine when they come to you. I will not promise you that you can just have a fridge full of vaccines and you start selling vaccines. It doesn't work. I mean, I've stayed in this thing for a long enough time to know that except you as a pharmacist have a vision and a strategy, which is different. The strategy to market vaccines is very, very different from what you do with the traditional medicines. Very, very different. I would suggest you go through a training yourself. And the second thing is have a collaboration with the vaccine distributor. so that you are very, very much aware of stock levels, because something about vaccine is stock levels can change anytime. And also, you were talking about a fridge. You know, it's not. Don't treat vaccines as products. Treat vaccination as a service. That's what I will advise you. Because once you get a fridge and you start storing these vaccines, the responsibility comes on you to be able to maintain the cold chain. But the reality is that if you're able to generate the demand, these wholesalers or distributors can bring it to you the day you need it. So you might not even need to keep any stock. That's the truth. Leave storage for the distributors and the manufacturers and wholesalers of these things, and you face the demand generation. If you've been able to convince 10 people to take the human papillomavirus vaccine, the more when you eventually tell them, all right, come on so, and you have the vaccine available. I have a nurse that's going to administer it for you, or you have an arrangement with this hospital where I send all my patients. If you so desire, as some other people do it, they get a vaccine, a vaccinator on site, and they choose a particular day that they do all their vaccinations. I don't want to go into the details of the legal tussle, but what I'm saying is there are a lot of options. But what is important is don't go into the business trying to hold the stock. That is not the stock that will sell, it's the message that will sell. But you need to be versed in how to message. You can see the value of vaccines I trained you on just a few minutes ago, and a whole lot of things you need to know. Without that knowledge, I'm sorry, we'll keep going round in circles of, I bought the vaccines, they expired on me and all that, which is not necessary. So I hope I've been able to answer your question. You can get across to me, and we can arrange for, further details about that. Thank you very much. Over to you, Fankoinde.
So the question we have for you says, I'm a pharmacist, but I haven't been using, okay, but I haven't been utilizing social media. How do you advise I start up? Okay, sorry, this person is saying they have a personal page and they want to know if, they want to know if they need to create a different one for their business. And okay, yes, they have Twitter, they have Facebook, but they want to know if they need to create a separate one for their business that separates their business handle from their personal handle.
Okay, thank you very much for that question. What I'd advise you to do first, you have to understand what your brand what your brand is going to be like. What do you want to be known for? What does your brand want to be known for? You have to understand that first before you now set out to create handles for your social media. So if your personal handle, if you want it to be just pharmacy related, then you can actually use your personal handle. But if it's just going to be about your business, I'll advise you open another handle so that it is strictly your pharmacy practice and nothing more. I hope I've answered the question.
Thank you, sir.
Okay.
Thank you very much, sir.
All right, understand.
Bye.
Oh,
Prophet Casson. Chewa, happy birthday.
Hello. Oh, thank you very much. Mo pe cake mi náà lè fẹ́ send àbí?
Demo.
All the pharmacists to nothing.
Okay, o ta lẹ ń kọrin fún bẹ́ẹ̀ báyìí.
Ta lẹ ń kọrin fún o. Ta lẹ ń kọrin fún. Profolinka is on the call from Zaria. Okay, congratulations.
Thank you very much.
Celebrant.
All right.